So Mindy, I'll jump back to you. What is your role in diagnosing Parkinson's? Why do we need experts, neurology experts like the two of you? And how do you treat the early stages of Parkinson's?
A movement disorder exam is actually quite extensive to give us more information to understand exactly what's happening in their brain. And so sometimes people come in with just one symptom, but having a thorough exam top to bottom helps us understand a little bit more about what they may be experiencing in the brain. Treatment, there's a wide variety of treatment plans. It just depends on the person. Again, like Dr. Schaefer said, it's an individualized treatment plan, always. Every single person that walks in the door and sits in the seat is ultimately looking for treatment, but they may not need it at the early stages. Sometimes I tell them, start exercising more, taking care of themselves. It's a whole body approach. It's an integrative process. And so sometimes people leave and they have medication that gets them started. But again, a lot of times the symptoms are so subtle that we don't have a clear diagnosis yet. So at the beginning, initially, they may not have the diagnosis of Parkinson's disease. And I say, watch and wait.
Selena, is the medication effective?
There are a whole host of medications that we can use. Interestingly, dopamine, our age-old medication, it was figured out that Parkinson's was a disorder of decreased dopamine about 50 years ago. And that's where we've started off with dopamine replacement. From 50 years ago to today, we have a lot of medications that we can use. They all work slightly different. Sometimes it's a combination thereof.
I see. And coming back to the holistic approach to treatment, Mindy, some of the symptoms you mentioned, for instance, constipation, is, again, something that many people have without having Parkinson's, but it affects those folks because the motility of their intestinal tract is affected by the lack of dopamine. So it seems to me that you also need nutrition guidance, you need common sense in some ways. And so how do you put that whole treatment package together? They see you, but what about the spectrum of needs that they have? How do you approach that in the Salisbury program for Parkinson's?
The nice thing about it is that we have this great program at Hoag where we have so many different arms. Ultimately, PT, OT, speech.
What is PT-OT?
Sorry, excuse me. Physical therapy, occupational therapy, speech therapy, which is a wonderful group of people that ultimately understand Parkinson's disease and can move forward with helping them. The second aspect is nutrition. What we do and what we put in our mouths are ultimately who we are. And so especially with Parkinson's disease, it's really important that we have a good idea of what's good for us and what's harder on us. 3, water, 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 water. If you're not drinking water, you're ultimately going to have a difficult time with motility, and ultimately your brain is 72% water, so you're going to function better. So all these ideas of what we need for different aspects of what we give at this center is pretty amazing.
Speaking of lifestyle, Selena, exercise. If I could bottle it and sell it, I'd be a gazillionaire. What's the role of exercise in Parkinson's?
Exercise is actually the real treatment of Parkinson's. So oftentimes people, they don't like exercise. Nobody likes exercise. However, so exercise is the true treatment of Parkinson's. It's what slows down Parkinson's. And
it actually slows down Parkinson's?
It absolutely slows down Parkinson's.
How does that work?
It's actually, we don't know yet. We have many literature, many studies and literature that actually show that exercise does slow down Parkinson's. It's not clear. I like big repetitive motions, stationary bike, elliptical, things that will help create circuitry in the brain. So that way we can use that circuitry later on. Sometimes though, it's any exercise. If I can't get somebody off the sofa, then any exercise is what helps.